Breaking COVID vaccines linked to higher cancer risk. New study reveals alarming findings. Hey everyone, I am Dr. K. Paul Stoller, and this video is about a bombshell new study that's shaking up the conversation around COVID-19 vaccines. Published in the peer-reviewed XGLI journal, this is the first population-wide analysis linking mRNA shots to increased cancer risks. Researchers tracked nearly 300,000 residents in Pescara, Italy, aged 11 and up, from June 2021 to December 2023. Using official health data, they looked at cancer hospitalizations after vaccination. Most got Pfizer or Moderna mRNA vaccines, with some AstraZeneca or J&J. The study adjusted for age, sex, comorbidities like diabetes and heart disease, prior cancer, and even COVID infections to make it fair. Here's the concerning part. Vaccinated folks showed higher cancer risks. Overall cancer, up 23% after at least one dose, 9% after 3 or more, both statistically significant. Breast cancer spiked 54% with 1 dose, 36% with 3. Bladder cancer, 62% and 43%. Colorectal, 35% and 14%, though the latter wasn't significant. Other cancers like leukemia, uterine, and ovarian trended up, but not always significant. Lung and prostate showed no increase. Only the strongest signals hit significance, but most cancers pointed upward. Why? The study highlights healthy vaccine bias. Vaccinated people often get better health care and screenings, which should lower cancer rates. Yet risks still rose, suggesting the true impact might be worse, or that other complex factors are at play. There's a mortality twist. Vaccinated had 42% lower all-cause death risk after 1 dose, 35% after 3. Sounds good, but the authors say it's impossible biologically. Vaccines can't make you healthier overall. It's bias. Healthier people got vaccinated. This masks the cancer signal. This aligns with concerns raised in other reviews that examine potential mechanisms. Some reports have estimated excess cancer deaths in certain data sets. A review cites multiple proposed mechanisms by which mRNA vaccines might affect cancer biology. These remain hypotheses needing testing, but the precautionary principle alone should put a moratorium on this mod mRNA platform. Many public health authorities continue to state that approved COVID-19 vaccines are safe and effective, because protecting policy, even if that means lying and pushing an intervention known to cause harm, is the priority. Remember, the CDC funds most public health departments, and when the CDC says safe and effective, then so do the public health departments. It is a rigged system. In conclusion, this 30-month study signals an association reported between COVID vaccines and certain cancer hospitalizations in one region. Be that as it may, for cancer, at least 6 studies show signals of increased risk, recurrence, or aggravation, including epidemiological data from Japan and hypotheses on oncogenic mechanisms. A literature review by Nicholas Hulcher outlines over 100 peer-reviewed studies suggesting mRNA vaccines may cause or accelerate cancer through 17 biological mechanisms, such as DNA damage, immune suppression, and chronic inflammation. What do you think? Drop a comment, like, and subscribe for more health updates. Stay informed. See you next time. Disclaimer: this video summarizes one study, but almost every day another study shouts out safety signals being ignored and why. This is a democide, and it is ongoing. Stay frosty.